Hi everyone, we're here today in the office of Dr. Adam Akers in Pikeville, Kentucky. And Adam, the reason that we're here today is because a lot of people sometimes have a misconception about a chiropractor, some of the things that they may be going through, that maybe they're taking pain medicine for, ibuprofen or whatever, and they're dealing with circumstances that maybe that you can help them on. So we're going to try to answer some questions today that some people have asked, and we've got those. Do you mind if us go through it?
No, let's go ahead.
All right, let's do it. First question. A chiropractor is only for back pain.
That's a big misconception. When you say the word chiropractor to someone that's never been, they have a visual picture of a guy holding his low back and that we only treat spinal pain, which is very incorrect. We treat as many ankles and knee injuries and shoulder injuries, appendages such as fingers from either accident or traumas. So chiropractors is any movable joint or fixation of the body or nerve damage or even muscle damage that we treat.
Okay, now Adam's going to go a few of these for you, and if you've got any questions, comment it on the bottom of the page or call the office and we'll try to answer those for you next time, okay? All right, let's move on. All right, next thing, a lot of people don't kind of wondering, if their kids are involved, is it safe for kids? I'm talking like elementary school children.
Strictly right after birth. We see kids with spinal dysfunctions as early as infant age, all the way to someone's 99 years old. Primarily my practice is Akers Family Chiropractic. We treat the whole family. Kids with scoliosis, spinal dysfunctions, physiological effects. A lot of kids that have repetitive ear infections. This is what a lot of people don't know, that we can trace that back to the nerve that could be causing the interference. And once we correct that, ear infections will dissipate. Headaches, migraines, all kinds of sinus disorders can be related. People just keep covering it up with medicine, and we don't treat the symptoms. We go strictly to the cure.
Now, you mentioned headaches. Just say, because a lot of things here in not only Eastern Kentucky, but around everywhere, a lot of people have like migraine headaches or just headaches in general, and sometimes they put that off and say, it might be my sinuses. But how do they know that, that is that something that you can help? And if it is so, is it something, I guess, that you can throw away maybe the ibuprofen or Tylenol for?
Yeah, there's different types of headaches. Biggest misconception is a headache, and that's furthest from the truth. We identify and are trained on what type of headache: cluster migraines, common migraines. Is it due to the spine, or do they have something going on inside? We can take care of all that from initial examination to locate the problem and correct it. Most of your headaches are called cervicalgic headaches. It means tension headaches from the neck or misalignments in the neck, and they've seen all these different doctors and they're taking all this medicine on a daily basis, and they really don't get relief, and all of a sudden after 2 or 3 adjustments the headaches actually go away. So a lot of people have been relieved through chiropractic care.
Next question, a lot of people want to know, is it expensive to come to the chiropractor?
No. We accept any type of major medical insurance, Medicaid, Medicare. You do not need a referral from your physician. You just strictly call our office. But if you fall in one of those categories where you're self-pay, after the first examination, our charge is $40 a visit. It doesn't matter what we do, how many type of adjustments or different therapy, massage, whatever you need, it's a strictly $40 a treatment.
So if you don't have insurance,
yes,
it's just $40.
It's $40, and we make it where it's affordable. So our biggest goal, we want people better.
Right. Speaking of that, a lot of times sports season's going on. We go out and watch football, volleyball. Your daughter plays volleyball and softball. You have a lot of injuries that happen. Is that something they can come here for you to be able to examine, or is that what they need to do?
From a chiropractic standpoint, we treat a lot of sports injuries, from volleyball to baseball to basketball, football, cheerleading. Cheerleading is one of the greatest ones we treat. Actually, I'm a team physician with a football team right now, helping out. So those ankle injuries, those knee injuries, we assess what they are. If they need an x-ray, we can order it. If they need an MRI, blood work, whatever it is, we treat it, get most of them actually corrected here. And if not, we work directly with the orthopedist.
Now, one person did bring this up, and I saw this as what is considered like a chiropractic myth. So okay. I want to see if you can uncover this.
Let's do it.
They said that, does it hurt? Because they hear sometimes, bones cracking or something, a movement. They're like, I just don't know if I can handle that. I mean, is that a normal occurrence, or?
Let's correct this, because this was a question last week from a patient. If you go on YouTube and you watch chiropractic visits, it makes a chiropractor cringe, because most of those videos are not correct. That's not what we're trained to do. It's low force manipulation. It's very specific. Chiropractic has actually improved over the years, and our education level is we go to school a little longer than a general physician. So we're highly trained in x-ray studies, locate, analyze, and correct a problem. So we use direct, local, easy force. We want it to be comfortable. When you receive an adjustment, it's immediate relief. It's not something you should cringe on. It's actually giving you relief.
Speaking about problems, a lot of people are heading back to work and sitting in the office. I know that some people get carpal tunnel. How do you know that if you even have carpal tunnel? And if you do, is that something that you can correct?
If you're having wrist pain with numbness in the fingers, it could be for many different reasons. Carpal tunnel is one of those conditions. We can actually locate that here, analyze that condition with your case history. To identify if you have carpal tunnel, we do order what's called an NCV, nerve conduction velocity test. It determines what nerve is being interfered and actually what the extent of it. If we get it in the early stages to moderate, we can actually manipulate that wrist, do some laser work on that nerve, and try to avoid surgery. Because that surgery is kind of in-depth and detailed, and there's a large recovery time from that. So if we catch that early and you're having that numbness because you're at that keyboard or you do repetitive motions at your work, don't let that go. Come in as soon as you can. Let's get that corrected to avoid surgery.
Now, I'm going to look at another question or a myth that sort of is thrown out to chiropractors, and we're going to try to get past that here today so you'll be able to help people that's watching. Is coming to the chiropractor, they say, oh, you have to come all the time from now on. I'm sure you've heard that too. And knowing that, when my family's come here, that's not the case.
That's a misconception. It is physical medicine. It's a form of rehab, just like physical therapy somewhat. If whatever condition you come in with determines how often I see you. Usually, if it's very severe, it's 3 times the first week, and then we actually reduce that next week or the following week to twice to once until that becomes stable. Once that condition is released, we release you. I've got tons of patients that had neck pain, and once we corrected that, I never seen them for years. And then the next time I see them, usually it's over something totally different. I bend over and my low back is hurting. The main thing is to locate, analyze, and correct it soon. Don't wait 10 years and think, it'll eventually get better. That's the worst thing you can do. Good Lord give us pain for a reason. That's just like a check engine light. That means go to someone qualified to find out your problem and correct it.
Okay, I want to just throw something else out there that maybe a lot of people have thought around, and I know that you know it as a chiropractor. You just heard a few moments ago, maybe you heard on the air, my knuckles cracked. Is that normal? Knuckles cracking? Is that just air pockets? What is that?
That is actually just a gas, where it's gas in the pocket. That's where you get the sound, the audible sound. Popping your fingers, by the way, is not a good thing to do because it's a different type of joint and you can over-accessory or overextend it. Make sure that you don't try to self-manipulate. That's another thing, is because you can cause damage. I can adjust my own self. So come to us, we're highly qualified to locate, is this a problem, and correct it.
All right. One final question, and again, if you have any questions, anything you'd like to ask Dr. Adam Akers, comment on the comments below. Like it, share this, please, and or just call the office. But we will try to make sure that we're going to try to do this very often to try to answer your questions. So make sure that you comment below. I know that you ran advertisements, and whether it be radio or TV, and you're talking about that. You try to get people in as quickly as possible when they are in pain.
Yes.
And trying to get people in. Are a lot of people taking advantage of that?
Yes, here's something we're doing in our office that is really helping the patient, and we've actually set our office up so we can accommodate that. If you have a problem, you can't wait 3 weeks to see a doctor, and I hear that repetitively, so we don't want to fall in that category. So if you have a problem, you call us before 10 a.m., we're going to see you that same day. We want to fit you in our schedule. If you call us after 10 a.m., we promise to get you in by the next morning.
Okay. It's very easy to do. You can call the office here, and we'll again post that as well in the comment section, and so that way you can be able to call and get your own appointment if you are in pain right now. Dr. Akers, thank you for sitting with us today, and maybe we could and hopefully answered a few questions. Yes. And I'm sure we can't answer them all, but if you've got any kind of question medically or about yourself, pain that you're going through, contact him and make sure that that we can try to be able to get that on
One other
next time.
thing, Dave.
Okay.
Let's include the most important thing. If you don't have a home church, I would love to invite you to Liberty Free Will Baptist. I also pastor a church for several years. We're located right next to Sears. Come out this Sunday. We're going to do parking lot service at 11 a.m.
All right. Thank you so much for tuning in. We hope that we've answered some of your questions and hope that we may have helped you. If we haven't, call the office, schedule an appointment, and he'll get you in that very same day if you call in by 10 a.m. Thank you for tuning in. And until next time, I'm David Branham with Dr. Adam Akers.